The hidden reason: penis size changes after 60. Have you noticed changes in size or firmness during intimacy and quietly wondered if there's anything you can do about it? I'm Dr. Lawa, here to help men over 60 understand what's really happening in their bodies and how simple, science-based exercises can bring back strength, control, and confidence in just a few minutes a day. What I'm about to share isn't a gimmick, a pill, or a surgery. It's a method that uses your body's own hidden muscles to naturally improve firmness, stability, and even how your size looks, no matter your age. For many men, getting older brings a quiet list of frustrations: erections that don't feel as strong, a downward angle that wasn't there before, or an appearance that seems smaller. It's easy to blame hormones or think it's just part of aging, but the truth is, there's an important mechanical part of your body most men never train, even though it's vital for sexual performance. Today, we'll explore those hidden muscles, see how they work, and go step by step through a 3-minute daily routine that can transform your performance and confidence. Pelvic floor muscles, the base of male performance. Inside your pelvis is a group of deep supportive muscles called the pelvic floor. Two of them play a key role in erection quality: the bulbar cavernosus and the ischiocavernosus. During arousal, their job is to trap blood inside the erectile chambers and keep it there under pressure. The bulbar cavernosus squeezes the base of the penis, pressing on veins so blood can't escape. The ischiocavernosus adds extra pressure, keeping the shaft upright and holding the youthful angle men remember. When these muscles weaken from years of sitting, less activity, surgery, or simple lack of use, blood escapes more easily. The result: erections feel softer, fade faster, and lose that stable, lifted angle. This isn't just theory. A 2005 controlled study, published in BJU International, followed men with mild to moderate erectile issues. After 6 months of focused pelvic floor training, over 40% regained normal function without changing medication, and another 35% saw big improvements in firmness, control, and satisfaction. The reason is simple: strong pelvic muscles improve something called venous occlusion, the body's internal valve system that holds blood in the penis. With better closure, you get more pressure, more stability, and longer-lasting performance. After 60, several factors speed up pelvic muscle decline. Sitting for long periods can literally switch these muscles off. Surgeries like prostate removal can interrupt nerve signals. Age-related changes in coordination mean that even if the muscles are there, they might not activate at the right time. The effects aren't just on firmness. Men often notice a lower angle, slower response, and even a smaller look. This shrinkage is usually misunderstood. The actual tissue length hasn't changed, but with less internal pressure, it appears smaller. The good news: you can retrain these muscles at any age. No gym equipment, no drugs, and see results in just weeks. To be clear, pelvic floor training won't increase your actual length, but by improving blood flow and pressure, it fills the erectile chambers more fully, giving a firmer, fuller look. There's also a nerve benefit. When you activate these muscles correctly, you send stronger signals to the brain. Many men say they feel more connected, more in control of rhythm, and enjoy more pleasure during intimacy. It's not only about performance, it's about regaining control over your body. Before you can train these muscles, you need to find them. The easiest way is while urinating. Try gently stopping the flow midstream. The muscles you use, without tightening your legs, stomach, or holding your breath, are part of your pelvic floor. Do this only once as a test. Repeatedly stopping urine can cause bladder issues. Once you know the feeling, you can practice away from the bathroom. Here's the basic routine: sit or lie down in a comfortable position. Take a few natural breaths to relax. Gently tighten those pelvic floor muscles, as if lifting something inside. Hold for 3 to 5 seconds. Fully relax for another 5 seconds. That release is just as important as the squeeze. Repeat 10 times. Aim for 2 to 3 sets daily. They don't have to be done all at once. Spread them across morning, afternoon, and evening. While doing them, avoid common mistakes. Don't tense your thighs, buttocks, or stomach, and don't hold your breath. Keep breathing naturally. Don't push down. The movement should be a gentle lift. Most men find they can fit this into their daily routine without stress or discomfort. Even doing a few rounds while watching TV or reading can help. Remember, this isn't about brute force. It's about control, coordination, and stamina. The first improvements often happen quietly. You might notice better muscle awareness, easier activation, or more endurance before you see visible changes. Once you can target the muscles, the next step is brain-to-muscle control, training your brain to activate them instantly when needed. Some men use biofeedback tools or guided apps to see real-time results, which can speed progress, especially if you learn best through seeing or feeling direct feedback. Even without devices, you can try quick, rhythmic squeezes to mimic what happens during arousal. Short squeezes, followed by full release, teach the muscles to react quickly, helping you stay in control when it matters most. Here's what most men notice with steady practice. Weeks 1 to 2, better muscle awareness. Even if contractions are weak, weeks 3 to 5, longer holds with less effort. Weeks 6 to 8, better erection angle and stability, more control during intimacy. Weeks 10 to 12, a fuller look, more firmness, and for many, renewed confidence, especially if blood flow was an issue before. Pelvic floor training offers more than just sexual benefits. It can help with bladder control, prostate support, and lower the risk of pelvic organ prolapse. It's low risk, doesn't interfere with medication, and can be done anywhere. For men avoiding medication or who get side effects, this is a safe, effective first step. Let me share a story. Mr. T, 68, came to me frustrated. He relied on pills before every intimate moment and worried about side effects. We added a simple 3-minute routine to his mornings. 10 weeks later, he told me, for the first time in years I felt in control. No pill, no planning, just me, confident again. That change wasn't magic, it was muscle. Hidden muscles he'd never worked before. Like any exercise, more isn't always better. Overdoing it can cause tightness or discomfort. If you feel pain, notice changes in urination, or anything unusual, see a healthcare provider. For most men over 60, this is a safe, doctor-approved method, but it's always smart to get your physician's okay before starting. If this gives you hope, give this video a like. It's a small action that helps more men find science-backed solutions without shame or guesswork. Once basic squeezes feel easy, you can add more challenge. Long holds slowly work from 5 seconds to 10 seconds while keeping full control. Quick pulses contract for 1 to 2 seconds, then release, building quick reflex strength for real-life moments. Functional practice, engage the muscles during everyday moves, like climbing stairs, lifting light weights, or standing from a chair, so they switch on naturally in daily life. These small upgrades bridge the gap between exercise and performance, making results feel natural. Bonus: men who keep these muscles strong often notice better posture, less lower back pain, and more overall energy because they're part of the body's core support. Think beyond the next few months. Healthy pelvic muscles support better bladder control for decades, help protect after prostate surgery, and give confidence in intimacy without worrying about losing firmness. You're not just training for now, you're building quality of life for years. Performance issues can quietly create anxiety. The more you worry, the harder it is to perform, and the more the muscles lose coordination. Training breaks this cycle. Once you feel the difference in firmness, angle, and control, the mental burden lifts. That confidence changes everything, in and out of the bedroom. Another patient, James, 72, told me he stopped initiating intimacy because he didn't trust his body anymore. 3 months into steady training, he regained reliable firmness and said his relationship felt alive again. It wasn't just his body, it was how he saw himself. Let's recap. Stronger pelvic muscles keep blood in place longer, giving firmer, more stable erections. Better brain muscle control means you can use these muscles instantly, without thinking. A fuller look and better sensation restore both body and mind. Confidence. Extra perks include bladder support, prostate health, and reduced injury risk. Every year you leave these muscles untrained, they weaken more. But start now, and in just weeks, you could notice changes that improve your whole life. You've just learned one of the best natural ways to get back firmness and confidence after 60. But there's another part of the conversation many men ignore: how your private habits affect your health, and when to talk to a doctor. In the next video, a urologist explains how to self-stimulate safely after 60 and when to seek medical advice. We'll cover how to keep this private habit safe, avoid hidden risks, and spot signs your body needs attention. Click here to keep learning and protecting your health. I'm Dr. Loa. Thank you for joining me in this important step for better male health. This video is for education only and shouldn't replace medical advice. Always talk to a qualified provider before making changes to your health routine. I'll see you in the next video.